My name is Dr. Peter Rich. I'm a dentist and surgeon here in San Diego, California in Poway. I am a 2004 graduate of Tufts University, and so I've been in practice for a little over 20 years. Was in the Navy as a dentist for a little while and then got out and got into private practice. I primarily have spent the 20 years learning implant dentistry and have taken a lot of continuing education and gotten myself to a point where I'm able to deliver some really life-changing dentistry for some patients that are, needing it. Shonda reached out to us on Instagram as a potential patient. She kind of explained herself to be an artist and a person who's in front of a camera and social media.
So my name is Shonda McGee, and I am a content creator, and I do abstract art. The main reason for my visit is, of course, my smile. I'm feeling a little nervous, but yet very excited for the outcome of my new smile. The first thing I want to do is be able to smile brightly in front of my audience and to have less discomfort throughout my day. I met Dr. Rich last year. I was looking for someone that I could trust, I could feel confident in to bring me the results that I was looking for. They've never felt comfortable, they never fit right. I'm always having to wear adhesives. They never fit properly, and I had talked to the dentist about, fixing them properly, and they want to keep charging you more and more money. And so therefore, I decided that it would be better just to go with implants, something that's more permanent.
She unfortunately got into a rough situation with her existing dentist and lost a lot of teeth. The first time we spoke with her, she just had a bunch of her teeth taken out and a denture that was put in place that didn't fit very well and was hurting her. And as a patient, she's going to be a remarkable person with a beautiful new smile, and we knew that we could help her out, so we took her case on. Our treatment plan for her is going to be a FP1 or FP2 type of procedure where we are going to place 6 implants on her maxilla, extract her lower mandibular teeth, place 6 implants on her mandible, and place, this is where the magic happens, some teeth in the same day that we're going to be 3D printing for her and stitching it all up, and that should be it.
Oh yeah, I'm so excited about being able just to smile with confidence and just show the world.
That's it.
Dean's getting set up right now, Arch, and then we'll get you. Yeah, with a new smile.
The potential challenges are pretty typical for a case where a patient's in a denture. Unfortunately, denture bone or people that have had their teeth extracted and have no teeth in there anymore have really soft bone. So one of the challenges that I know we're going to face, and we've already tried to mitigate some of this ahead of time, we anticipate that we'll have some weaker bone, and we'll anticipate that we have not the best quality of bone to put our implants into, but we've meticulously planned her surgery out. We're very confident going forward that we're going to get, all of our implants in the right locations in the best bone that she has, and give her some new teeth. The best possible outcome we can achieve for Shonda is some variation of an FP1 or FP2 type of prosthetic, which is basically a set of teeth that have the patient's natural gum line and then have a beautiful aesthetic appearance to them. If we can get her the most realistic life-size teeth, that's a successful FP1. If they're a little bit longer because of the fact that she's already had her teeth out and bone loss from the denture, it'll end up being a little bit longer teeth, but they'll still look beautiful, and it's usually above the lip line so no one will see it. Our procedure is about a 6-hour-long surgery. That includes our patient coming in for general anesthesia. I have a board-certified anesthesiology team that comes in, puts her to sleep, monitors her while we're working and doing our thing. and then the surgery pretty much goes the full 6 hours. It's not that we're doing the surgery the whole time, but there's printing of the prosthetics takes a little while. The laboratory work, kind of combining those things together, ends up adding some extra time into the process. But the result is that patients leave with beautiful new smile the same day, and it's their own healthy gum tissue and their own healthy bone. I've been in the true abutment sphere for probably close to 15 years. I've been using a lot of their products. I've been using a lot of their implants. I love the simplicity of their guided surgery kit. It's probably one of the best on the market, and I've used many different implant systems. For the most part, I think their guided surgery kit is amazing, and the Pylon kit is leading the way in implant dentistry and getting good guided results. This has been a culmination of a lot of years of studying and a lot of years of hands-on practice on patients. Dentistry is never something that's static. We're always growing, we're always learning. It's a practice, truly. There's things that I screw up and have to redo all the time. But it's just one of those things that if you had asked me 5 years ago if I was going to be in this position to be able to change people's lives or deliver new sets of teeth in a day, it was something that I always thought was really cool. I'm at the most satisfied point in my career being able to do this. It's literally the most fun I've had in dentistry in 20 years, and it's all just been steps to get to this point, basically. So it's fun. Right before I started this.
Yeah, my name is Stephanie DeLuca. I am a RDA. I have been with this practice for 5.5 years almost. So it's been quite a long time. I actually started my journey with him, and we have grown together a lot. He's shown me everything I know in implant dentistry, and actually everything I know just in general through this whole phase of turning more into a full rehab kind of case by case for patients. It's very exciting and very heartwarming to know that you're changing lives for people that think they can never eat or are very debilitated and in that kind of aspect on their teeth. So it's very exciting.
T-marker is really cool. Takes a little bit of getting used to, I think. I know my team will continue to use it and just improve on the way that we get that workflow going. But yeah, the T-markers themselves went pretty well and pretty easy process.
Definitely a learning curve, but it would only get easier to use as you use it. There are a lot of just different things that you can do with it than what I was used to today. So just kind of learning that was really awesome. The flags, or the markers, if you want to call them, are a lot smaller than what we're used to using. So that also makes it a lot more helpful to place them in the mouth and get them around teeth and whatnot. Because that's always the hard part with any of those photogrammetry situations, is trying to get them and make them all fit.
It's okay, we'll figure it out. I just want to see if you can, we're having issues in the two distal. I mean, it's a very common process for our office to do these procedures. None of them are the same. There's always a chance that we have, some variation from patient to patient and case to case. So overall takeaway, I think this patient in particular, I know, will be extremely happy that she's got some permanent teeth coming to her and doesn't have to worry about putting this, uncomfortable denture in and out of her mouth anymore. I know she'll be happy with the result in the end, and she's got the healing process that needs to start, and starts today.
The result was amazing. Her teeth fit beautifully after surgery today. We had no issues with any of the scans. Everything was perfect. The lab did amazing work today for us also, in making sure everything fit. I can't say we could have gotten anything better as a result. It was beautiful.
Patient came in today. We did lower extractions on our patient and used some photogrammetry techniques from T-marker and true abutment. Recorded implant locations, sent that off to the laboratory, and created a lower prosthetic for the patient that's screw retained and permanent. And then we repeated everything for the top, which was a little more challenging than lower arch. The bone quality was really bad under the denture that she had been wearing for a long time. So unfortunately, we couldn't get perfect implant placements and perfect torque values, but we still got a pretty good result on it, and I think she'll heal pretty well nicely. Yeah, 7.5 hours. To me, it's really fun to do this type of dentistry. It is hard work, but we don't do it day in and day out. Like, we do 1 surgery or 2 surgeries a week is probably about the max that we could do. There is a significant reward in doing them. I mean, it's fun to see the outcome. It's really rewarding to see somebody who had a really hard time end up with beautiful teeth and a smile that they're proud of and that they don't feel embarrassed about anymore, that doesn't hurt them, that gives them function to be able to eat things that they need to eat, to make their health good. So she's a special lady. She's a diabetic. She's had a rough go of it in her life, and she's a person that I felt like drawn to help in this way. I have other pivots that I want to do in the future in terms of giving something back. I'm a Navy veteran, and I would like to help out some vets that might be in a situation where they need some teeth and some help as well. So there's a financial reward that comes with doing dentistry, right? We're paid for the expertise that we have and the skill sets that we have, and the higher the skill set that you have, the more you earn from it. It feels good to be able to give back. If you can do it, you do it.
It's amazing to see somebody, like even today, she was not as coherent when I saw her, of course, coming out as I normally do patients. But it's amazing, the reaction. They're like, oh my God, I have teeth. And they're just smiling. And half of these patients that come in who didn't have teeth and they're in their finals, they would never smile. You'd never know they didn't have teeth. And they're now just grinning and smiling and have such more of a personality even to even want to talk to people. I mean, it's changing lives. It's amazing.
I would like to say thank you, Dr. Rich, for giving me back my confidence, to giving me an amazing smile. You and your staff are just beyond what I would ever expect.